So here the insulin chart. So we use the insulin for type 1 diabetic mellitus, and type 2 is treated by oral hypoglycemic agent like metformin. But type 2 also need insulin when oral hypoglycemic agent is not enough to control hyperglycemia. And insulin has several types. The insulin is categorized on base of their duration of action, right? So one of the type is called rapid acting insulin, or short acting insulin, then intermediate and long acting insulin, right? So here in the picture showing hemoglobin A1C, we know when the blood glucose level is more than normal, we say hyperglycemia. But before to say diagnose a patient is diabetic, the more confirmatory test is hemoglobin A1C. If hemoglobin A1C is more than 6%, we can say the patient is a diabetic. But if the patient has a diabetic already, that times the target level of hemoglobin A1C must be below 7%. So here showing this is the pancreas, and pancreas secrete two type of cell, alpha cell and beta cell. Beta cell secrete insulin. If beta cell does not produce insulin, then glucose does not metabolized and patient develop hyperglycemia and it is called diabetic. Or if the tissue is the insulin resistant and also can produce the diabetics, right? So we said basically for when patient need the insulin, we should use different type of insulin. First one is called rapid acting insulin, right? Rapid acting. Example is called Aspart. It's called Aspart or Novolog, Aspart or Lispo. It is the rapid acting. Rapid acting insulin usually do not mix. We use alone, right? Like Humalog or Novolog, we use alone. We do not mix the rapid acting insulin. And also keep in mind, they start action so rapidly. After using, they can start the work within 10 to 15 minutes. 10 to 15 minutes. So as a RN, when you give them, or LPN, when you give them this medication, sometimes we give 15 minutes before the meal, before the food, okay? And the peak onset is 1 hour, duration is 3 hours. So what are the indication of the rapid acting insulin? First of all, used for the rapid reduction of blood glucose level. Rapid. Suppose a patient has a diabetic. Sometime in some, unfortunately or fortunately, if they eat too much, like in the dinner, then rapidly blood sugar go up. Just give one dose of rapid acting insulin and blood glucose go down. So also they treat the postprandial hyper. What does it mean? Postprandial means after food, after lunch or dinner. If anything is more food, chance of increase, that times we can give it, right? So basically rapid acting insulin, what I said, do not mix with other insulin. Better to give alone. And rapid, I mean the peak of onset is 30 to 90 minutes. right? Or 1 hour. And onset is 10 to 15 minutes. And I said 15 minutes before the food or meal, we give it to the patient. Another insulin is called the short-acting insulin. Short-acting insulin. The short-acting insulin, other name is called regular insulin, right? Short-acting insulin is called regular insulin. So regular insulin, other name is called clear insulin. Regular insulin called clear insulin, right? So if I go back in the table, another insulin called intermediate insulin. Intermediate insulin, shortly called NPH. NPH stand for neutral protamine hegadon. So this is the NPH stand for. But NPH is a cloudy insulin. Short-acting insulin is the regular or clear. Intermediate insulin is NPH or cloudy insulin, right? So in this picture, just a symbol of picture, the clear one. So basically reality is the clear insulin like this, transparent. Cloud insulin look like this one, cloud insulin, right? So basically, I am saying when we have to mixturing the two insulin, always we has to draw the clear insulin first. Clear insulin means short-acting insulin or regular insulin. So we has to withdraw the clear insulin before or regular insulin before or short insulin before, because it is same name, short or regular or clear. And another one is cloudy insulin. So intermediate insulin or NPH or cloudy. So cloudy insulin we has to withdraw later on, right? Regular one is first, then cloudy. Other name of cloudy insulin, intermediate. Other name of intermediate insulin is NPH. NPH. So when we mixturing the two insulin, always clear insulin first, then cloudy, right? And say clear insulin is called regular insulin and cloudy insulin called intermediate or NPH. Easy to remember, RN, R for register and for nurses, right? RN, R for regular insulin and for NPH. So regular insulin withdraw first, then NPH. But we already know other name of regular insulin means short-acting insulin or clear insulin. NP means NPH. Other name of this, they are cloudy insulin or intermediate acting insulin. So I'm going to go back here. So could you remember I told you the rapid acting insulin usually does not mixturing with any other insulin. But the short acting insulin sometimes make a mixture with the intermediate insulin. So it is the question come, which one take first, that I talked few minutes ago. So short acting, regular, intermediate, NPH. Other name of regular insulin called homolog R, novolin R, right? And intermediate one is called novolin L or novolin N. How we have to remember, my friend? So short acting name is regular, but you can say homolog R, R stand for regular, novolin R, R stand for regular, and novolin L or novolin N, it is actually almost similar to NPH. And NPH insulin is the intermediate insulin, or they are cloud insulin. Short-acting insulin, basically, we have to give 30 minutes before the food, 30 minutes before meal, right? So here is something important. Short-acting insulin sometimes make a mixture or combined with a longer insulin as well. Short-acting insulin, not only the intermediate insulin, they sometimes short-acting insulin combinedly given with a long-acting insulin. And also the peak of onset of regular insulin is 2 to 3 hours. Just multiply by this, 6 to 12 hours is intermediate insulin peak hour, right? And now go for long acting insulin. So long acting insulin, or other name is called ultralenta, or very long acting is called glargine. So the also it is important, we has to know intermediate insulin we give twice a day. We should give twice daily. So 12 to 18 hours, and onset is 2 to 4 hours. And long acting insulin, especially the glargine, or some book divided the long acting and very long acting. But easy, make it easy. Long acting is a glargine or ultralenta. So glargine has some advantage. What it is? You see, the peak level or onset is a 1 hour, and peak is continue they work all day long, right? So a single dose can cover all day long. So long acting insulin like Lenta is the once daily, right? But it is important, let your patient know when it is good if they use the same time every day, right? And also they said indication use for basal dose and also at the bedtime. So this is help, and some note here what I explained, everything is writing on the bottom. So when you study together, I mean alone, you has to go through. So now I'm showing you, and here when we prepare the insulin, so always keep in mind we have to wash the hand, then we will not shaking the vial, we has to just rotating inside the two hand, rotate. Okay, so because if we shaking like this, the insulin chance of the broken down. So it is important for we has to know. So